Thinking about the antipsychotic medications, you know, especially with the older ones, that they will give you a lot of movement disorders. So what we have is the most common of these movement disorders, including acute dystonia, bradykinesia, and akathisia, as well as others. Let's begin with acute dystonia. When we think of acute dystonia, what typically happens is that the patients take their medications, and within hours to days, they will develop side effects. Now, these side effects typically consist of spasms, muscular spasms. For example, patients can get torticollis, where they get spasms in their neck muscles so they're unable to move their head from side to side. They can also experience something called oculogyric crises, where their eyes roll up and of course they can't bring them back down. They can also get laryngeal spasms, etc. So imagine yourself getting one of these medications and having one of these side effects. It can definitely be very frightening and very dramatic. And that's usually one of the reasons why patients stop taking their medications. Young men might be at higher risk of developing this disorder, but it is only seen in about 10% of the patients. Because this only occurs in 10% of patients, the treatment could either consist of A, preventing the dystonic reaction, or B, treating the dystonic reaction once it occurs. And the way to treat it and or prevent it is by giving patients anticholinergic medications. So you might administer drugs like benztropine or diphenhydramine or trihexylphenadil, either with the antipsychotic or wait for the side effect to occur and then administer it to the patient. Bradykinesia is another common side effect that typically will occur within weeks of treatment, and this is nothing more than slowed volitional movement as well as increasing muscle tone and the resting tremors. So patients look like they have Parkinson's disease. The reason being that you are lowering the level of dopamine by giving them the medications. So patients, of course, will have a limited amount of facial expressions. You have that festinating gait. You also have that cogwheel rigidity and that pill rolling tremor that is so common in patients who have Parkinson's disease. As far as risk factors, this is going to be seen more frequently among the elderly. And make sure that the patient is not catatonic or has any kind of withdrawal from any medication. Akathisia is a generalized restlessness. Now, this also takes weeks to develop, and it's a direct side effect of the medications. The patients typically describe it as having ants in their pants. So you want to make sure that you rule out any other causes of the akathisia, and of course the elderly will be more at risk. So one of the treatment options is to either lower the dose or add a benzo or add a beta blocker, but ideally the best treatment will be to switch to a newer medication, that is, switch to an atypical antipsychotic which has less of a chance of producing the akathisia.